So in the clinical guide to support practitioners in working with children who have been traumatically bereaved, we talk quite a lot about relaxing the body and relaxing the mind and supporting children and young people to find ways to help kind of manage their physical and kind of emotional experiences. Can you say something about why that's so central?
I think it's probably an important component in the work that we might do with a child or young person that's been traumatically bereaved. Essentially, we're wanting to create a sense of safety in the room, a sense of calm, so it can be helpful as we then embark on some more difficult conversations and potentially bring some memories that might feel quite difficult into the mind, that child or young person has got a rehearsed strategy of managing if their body starts to feel a little bit more tense, and they've got something they might then be able to take out of the session into everyday life to help them if they're struggling with waves of emotion and they want to kind of calm their body down if they're struggling with some of those trauma memories.
So it sounds like that could be really helpful both in the sessions and in the process with the practitioner and also outside for the child or young person. But do you feel like it's always necessary when we're doing this work to include this element?
I think it's really difficult to say always necessary because every young child and young person is going to be different. But I think it's probably likely to be a very helpful part of our work with most children and young people. But we'd have to kind of, I guess, negotiate with the child or young person, explaining why and how, and seeing whether they're comfortable with that.
Okay. So it's something that should always be sort of, that the practitioner should always have in mind and always try and introduce and kind of, as you say, work out with the child or young person how and whether that's going to be possible. Okay. And what exactly does that involve? So when we're thinking about relaxing the body and relaxing the mind, what do you actually do with children and young people?
I guess typically we might start with a body scan. Can the young person even identify where in their body have they already they're holding some tension? So can they do a scan upwards, downwards to work out where in their body might already be feeling a little bit tense? And then that enables us to go into some form of muscle relaxation, whether it's tensing and relaxing, whether it's using a story to help particularly with the physical parts of the body. And then we might also do something around calming our mind down, and by doing something like mind travel we talk about in the clinical guide. And then of course there's lots of technology and apps and things that we can make use of for young people where they want to use one of those as a way of doing some mindfulness or finding some other ways of regulating their breathing and calming down.
Okay, so it sounds like it might be very playful and kind of might use stories and play, or it might be something that's a bit more that you can explain more in words and also use other kind of props and sometimes technology can be involved in that as well. Okay, so Wesley is one of the characters that appears in the animation and also in the clinical guide, and Cara is another central character. I guess I'd be interested to hear a bit about how you might introduce these ideas to Wesley, first of all, to kind of help him to kind of buy into it and really understand and believe that this might be helpful to him. What might you say to Wesley?
Yeah, I think if I had a 15-year-old young man who's clearly struggling and having a very tough time, I'd want to be very mindful of asking anything that might feel uncomfortable and strange. But I think when we've got confidence in why we're suggesting the activity, that can help and that can be conveyed to the young person. And if we can give them a really clear rationale, this is why we want to do something that might feel a little bit weird for a moment, but there's a really good reason for it, because actually we've been hearing about how hard it is for you to even think about your dad and how hard it is for you to even talk about him. So if we can if we can have a go and find a way of you having a safety net, a way that you know that you can help your body relax again and feel a bit calmer, then maybe you'll feel more confident in having some of those conversations with me in the sessions that go forward.
Okay, so it's sort of naming something about the awkwardness, but also holding ourselves as practitioners, us not being too awkward and actually being quite confident that this could be helpful if it's given a go. And what about with a younger child like Cara?
With Cara, it may be that she's more, at age 6, maybe that she's more readily eager to do something, particularly if we can dress it up through music, through story. In the clinical guide in the appendix, there's a lovely story about a scarecrow and how he goes from rigid and tense to relaxed. We might even, with Cara, who likes the pet cat, we might do about the tense cat and the relaxed cat. So drawing in on her interests. And maybe she's more used to sitting with her eyes closed when there's a piece of music on at school. So we might be able to find out things that she already enjoys to relax and then kind of harness those and use those as tools to facilitate her relaxation in the session.
So it's sometimes using something we know about the child or young person, and sometimes also really applying what we understand about their age and developmental stage. Brilliant, okay. And is there anything else we can do in terms of creating an environment that helps a child feel safe and feel able to kind of try these relaxation techniques? Or even with our own bodies or with our own kind of, our own presence, how do we create that sense of safety?
That's such a good question, isn't it? To think about not just the activity that might create a sense of safety, but all those things around it in terms of the environment. Is this a room? Are we in a place where this child feels relaxed and safe? Is there lots of traffic coming past? And obviously we can't always create the perfect space, but can we allow the young person, the child, to work out where do they want to sit? Where should we put the table? How do you want to be? And then absolutely, as you said, about being mindful of our own bodies. And if we're sitting there tense, then that might convey something that isn't so helpful to a child. If we're able to show the relaxation and actually take part in it with the child, maybe that's a way of us being aware of our own body and working out how we can help the child feel more relaxed.
Yeah, I think sometimes you can really model something. You can kind of, and that really helps the child or young person come through that awkwardness or that sense of kind of unease to something more comfortable.
And then I wonder whether it can also be part of a really familiar routine in our sessions. Once we've got that going, that we set up the room, we create a place that feels calm and safe, and then maybe we'll do a little bit of that relaxation to start the session and get us in a place where we're ready to talk about and think about some of those things that have been really hard for them with their traumatic bereavement.